thank you so much for joining tonight. We're going to be discussing combating COVID-19, Japan's response and efforts. We're going to be talking about the latest COVID developments and the situation in Japan that has gotten a lot of attention, the Japanese government's response to the coronavirus, and Japan's COVID-19 vaccination rollout. I want to thank our sponsors for tonight, the Business and Policy Program, our global leaders, Citi and Deloitte, our corporate partners, Mizuho Financial Group and Toyota North America. But I want to particularly thank the Japanese government. This event is part of the Japanese government's Walk in the USA, Talk in Japan program. It's an opportunity to learn from experiences around the world and really bring the US and Japan into the forefront as we combat a common pandemic. I can't think of a better panel than tonight, and our moderator is a good friend who knows this topic better than anyone in this space. Jim Gannon is the Executive Director of the Japan Center for International Exchange. Jim, let me turn this over to you so we can get the event started and learn. Jim, over to you.
Josh, thank you very much. Good evening to everybody. Good morning to wherever you are around the world. I think we have a great panel today. As Josh said, I work at the Japan Center for International Exchange, and a lot of our work is on US-Japan cooperation on global health. So because of that, I know that the two panelists today are really at the top of their field in Japan. So this is going to be a real education, a real treat. Dr. Tomoya Saito is an expert on public health emergencies, and I won't go through his entire bio because there's a very good bio on the Japan Society website, but he currently is a director of the Center for Emergency Preparedness and Response at the National Institute of Infectious Diseases of Japan. Previously, it served several years as an official in the health ministry, and currently he's also working with the health ministry in Japan as a member of their Cluster Response Task Force at their COVID-19 response headquarters. He's also the Japan representative to the WHO Review Committee on the Functioning of International Health Regulations during the COVID-19 response. That's a real mouthful of jargon for those of us who are not in the global health field. But for somebody who has a foot in that field, that really means that he's one of the most prominent figures in Japan. As you know, the WHO has gone through a bit of controversy right now. So the fact that he's been selected to be Japan's representative on that panel is very critical. He's going to be paired with Dr. Haruka Sakamoto, and she is by training a primary care physician, but she's also dual-hatted. She's an assistant professor at the Department of Health Policy and Management at Keio University. She also, like Dr. Saito, served several years in the health ministry in Japan. And she's currently advising or being called upon to advise a wide range of global health organizations that work in Japan. Both of them are quite prominent experts on the topic here. So I'm really looking forward to what they have to say. The way we're going to run this today is, I think to prime the pump, I'm going to start asking them a number of questions. We'll do 3 or 4 rounds of that to just get a baseline. And then after a bit of that, what we'll do is switch to the audience questions. And there are a number that were pre-submitted that I'll go through. But also I encourage you on YouTube, you should be able to put in your questions there. So as they come in, I'll try to field them, but I'll warn you, there are already a lot right now. And this, I should note, this is going to be an on-the-record discussion, obviously. Before going to Dr. Saito and Dr. Sakamoto, I just wanted to step back a little bit and really think where we've come from. On this day last year, 1 year ago, February 25th, 2020, I was actually in Tokyo. I was in the process, my organization was in the process of canceling a major international conference, and that's what everybody was doing at the time. There was a real sense of impending doom. Japan had 1 month earlier, the first COVID infection had been detected in the country. And this time, exactly a year ago, if you remember, the famous cruise ship, the Diamond Princess, was parked in Yokohama Bay and passengers were still at disembarking. And there was really quite a bit of criticism, I think, domestically about the government's approach. And there was a bit of carping in the overseas press as well. And meanwhile, back here where I'm in New York City, things were still normal. It was actually, at this point a year ago, there'd been no confirmed cases in New York. It was actually later in this week that we found the first case. And it was still 3.5 weeks from the big shutdown that we had in the city. But now we've come a year. In New York City here, a year later, it's 1 in every 293 New Yorkers has died. And what that means in a human sense is that for those of us who have survived, on average, we'll each know at least 2 people have died of COVID. Meanwhile, by comparison, of course, Japan has also suffered grievous loss. But by comparison, in Tokyo, at this point, I believe it's about 1 in every 10,600 people have died. So it's quite a stark comparison for me. So even though, at the beginning there was concern about Japan's approach, clearly something right has been done here. This is not just luck. And I think all of us wish that we could have done as well as Japan. And so this is what I really think it'll be important to press our 2 speakers, our 2 experts on today, is what lessons can we take from Japan, and how has Japan gotten to this point? So what I wanted to do is start with Saito Sensei. And I think if we were having this discussion 3 or 4 weeks ago, we'd be talking about the surge in Tokyo, but I think it's in a different state right now. And if you could tell us a little bit, what's the current state of affairs in Tokyo?
Thank you very much, Jim. And it's a great pleasure to be here. Thank you for inviting me here. And before starting my talk, I'd like to express my condolence to those who died for COVID-19 and those who lost their family due to the COVID-19. So I'd like to briefly describe our situation. So I'd like to use the slide. So could you, Aki-san, please go to the first slide. So here I show the epic curve of the Japan and Tokyo in the left column. And we had a relatively small so-called second wave in the summer, in the end of about in the late July to August. Then we had a relatively stable epidemic situation in the early autumn, but the number of cases gradually increased in late November, and we observed the exponential growth in the end of the year and the early January. Maybe it's primarily due to the Christmas parties or the end of year party by the younger generation, and also the travel from the central Tokyo to other parts of the Japan, but we do not know the exact reason. And fortunately, the number of cases started to decrease from the early January, and government also declared the second state of emergency since the January 7th. And it's planned to be just for 1 month, but we extend another month, and we lift the state of emergency on the March 7th. But we are successfully controlled the third wave at this moment, and we can manage to the cases about 2,000 or 3,000 a day at this moment. In total, we have the 400,000 cases. That is equal to the 4,000 per million cases in the population. Could you go to the second slide? So as you see in the left, so the cumulative cases are very small at this stage compared to the other European and North America. And could you go back to the first slide? Then also the number of confirmed deaths is about 7,000 to 8,000 now. And could you go to the second slide? That is about 700 per million population. That is quite a small number compared to other countries. So, but we are facing the, how we should control so for the next stage, and because we have to lift the state of emergency, and also we should think of the opening the borders or the reopening the economic activities. So, and now we are discussing the next strategies. Thanks.
And Sakamoto Sensei, can I ask you to add to that, in particular from your perspective as a primary care physician?
Okay, thank you very much for giving me the floor, and thank you very much for inviting me today. It is my great pleasure. So the current situation, so we experienced the biggest wave since last December to early January. As Saito Sensei mentioned, I think we can still say we could control the COVID-19 well so far. I think there's mainly two reasons. One is that when considering the aging society in Japan. I think the Japan is one of the most aged country in the world, and then the proportion of the older people, those who are aged 65 years old, is almost 30%, which is the highest in the world. And then considering the characteristics, which COVID-19 is particularly impact for the older population, I think Japan's mortality rate is still very low compared with the other countries. And then the other point is that like big cities like Tokyo and then Osaka, this population density is not very high, which is also the challenges for the COVID-19 control. So thinking the two characteristics in Japan, I mean, one in aging population, and then one is the population density. I think the number of the proportion of the mortality rate is still very low compared with other countries.
Thank you, Sakamoto Sensei. And I want to follow up with you on this. And you've talked about the aging population, and particularly in the United States, this is where a lot of the deaths have been concentrated. It's actually the number of deaths in nursing homes and long-care facilities in the United States is 36% of total deaths, which is extraordinary. Why is that not the case in Japan? How has that been prevented?
Okay, yes, thank you for that question. Yes, and it is true that the number of the deaths at the long-term care facilities is very low comparing the United States and European countries. And then I think this is because there's solid countermeasures at those facilities. And then in Japan, we introduced the long-term care insurance system in 2000. And then under this system, long-term care facilities are required to set up committees to deal with the infectious disease within the facilities. And in addition, the prefecture government and then local governments is supposed to audit the infectious control status of the facilities on a regular basis. Even before the COVID-19, it started in 2000. So there's a kind of the basis for such solo countermeasures against infectious diseases at an ordinary time. So I think this works very well at the time of COVID-19.
So it sounds like it was an issue of preparation, really.
Yes, yeah.
I'll go back to Dr. Saito, and I want to push to stepping back, not just for the aging population, but what really have been the main elements of Japan's COVID response?
So the answer may be very simple. The early detection and early response is a key word, and it is the basic principles of the infectious disease control. So we could detect the first case coming from China in the middle of January. It was the second case in the world outside China following the Thailand to detect the case. So we could recognize this threat very early, and also we could find the minor clusters in the country in early February before we have the exponential growth of the cases. So we can earn time to characterize this disease, and also we can have time to develop the certain strategy to encounter this disease. For example, the cluster response strategy is one of those we developed during the early phase. So through the field investigation of and contact tracing, and we recognize that the disease dynamics is based on the chain of clusters. So not all the infected people infect others, but only the 20% of cases make a big cluster and chain of cluster will make this epidemic. So we focused on the containment and tracing of the clusters in the early phase. That was really successful. And also we developed we identified the risk factors to make such clusters. So it's so-called the 3 C's concept. Avoid 3 C's. It's the closed spaces and closed contact and crowded spaces. The 3 environment are the risk factors, and we called for we asked the whole population to avoid such environment. These 3 C's became very, very popular, and the word of the year, awarded for the word of the year in Japan. So that communication campaign was very successful, and everyone can avoid such risks themselves. That was become a very basis of the COVID-19 control in our country. So that was the our for the success series behind our success in the early phase.
Good. And I want to just press a little bit more on this cluster-based approach, because of course, in the United States, by the time it had exploded, you had too many people sick to be able to be out there tracking clusters, which requires a lot of, healthcare workers to track down the people. But that's always been used in epidemics. But I understand this time, Japan's used quite a unique new approach, a retrospective cluster, retrospective contact tracing. And maybe if you could just tell us a little bit, how do we understand that? Why is that different than the normal approach?
So usually the contact tracing is tracing those contact of the confirmed cases and prospectively, isolate the closed contacts and and stop the further chain of spread. But in the early phase, it is quite difficult to find out the cases because the symptoms are very similar to common cold, and we did not have a good testing capacity at that time. So to find out digging out the hidden cases, the retrospective contact tracing was very effective because there should be, if you find a case, there should be a big cluster behind that case. And so if we could identify the source of infection of the case, we could find out more cases, more of the cluster, and more efficiently. That was our the concept to allocate our resources to finding out the cases in the early phase.
Thank you, and that's very helpful to know. So we're really talking about the 3 C's, or sanmitsu is one pillar of the approach, and then the cluster-based, and really this retrospective contact tracing is a really unique innovation. I'll go to Sakamoto Sensei. What would you add to this?
Okay, yes, I think the cluster approach and then the sanmitsu 3C approach is the major characteristics of Japan's COVID-19. And then also I'd like to emphasize the healthcare system in Japan. So there's a 2 point about the healthcare system. One is the public health center. We have the public health center across the country, and then its history went back to the 1950s and 1960s when the tuberculosis was one of the leading causes of this in Japan. So at that time, public health center played a very important role for detecting and then isolating the patient of the tuberculosis. And since then, public health center had been playing a very important role in the community to any kind of the infectious disease control. So very at an early stage of the COVID-19, again, the public health center has been playing a very important role because they have the rich history, rich experience about the infectious disease control in the community. Their knowledge and experience can be utilized in this time of the COVID-19. And another point is that we have the robust healthcare system, known as the universal health insurance system. So those who are living in Japan are required to enroll the universal insurance system. And then once they enroll in the universal insurance system, they can freely go to any healthcare facilities without a very few amount of the money. So if someone has a symptom suspicious about the COVID-19, like a high fever or shortness of breath, they can go to the healthcare facilities without any concern about the financing. So I think the public health center and then also the universal insurance system is to also support the Japan's COVID-19 approach.
Thank you very much. So just to put it in realistic terms here, I mean, because of course the health insurance is such a big issue in the United States. If I was to go to the doctor in Japan for even just a normal checkup, a fever, et cetera, what would the bill be?
So first, we do not have any gatekeeping systems. So you can freely choose any healthcare clinics and healthcare facilities in the clinic. Even you can go to the bigger hospital. And then it depends on the age and your income, but usually the patient only pays the 30 amount of the healthcare financing, healthcare expenditures.
Okay, thank you. I want to talk a little bit, so we're getting a picture of what the current situation is, but how things are going to evolve going forward. And so I think maybe Saito Sensei first, I'll ask you on vaccines. And those of us in the United States, I think everybody's either scrambling to get a vaccine or online trying to get their mother or grandmother an appointment, which is a very frustrating and decentralized, disorganized process. What is going to be happening in Japan? Because I think vaccines are just starting to roll out this last week.
Yep. We just started the vaccination program for the healthcare workers last week, and we're going to continue this prioritized vaccination program for the healthcare workers in the early March. And then in April, maybe we can start the vaccination for the elderly and those who have the underlying diseases, and then the or other populations. So, and I don't know how much quantity will be available and how much percent will be covered in the next year, in this year. But we have carefully started the vaccination program, and also we should monitor the coverage and also the adverse events, which we just launched.
Thank you. And Sakamoto Sensei, is there anything that we should be paying attention to?
You mean for the vaccine campaign? Yes. Okay. So I think the risk communication is the key for a successful vaccination campaign. So back to the 2013, when Japan introduced an HPV vaccine, there's some kind of the negative campaign about an HPV vaccine because HPV vaccine is not really safe. So the prevalence of the HPV vaccine is very low in Japan compared with in other countries. I think it's less than 10%. So in other countries, the HPV vaccine is already 80% or 90%, but in Japan, it's still less than 10%. So how we can communicate with the general public, the COVID-19 vaccines are safe and very effective is the key.
That's good. And are you hearing many people who are hesitant to take the vaccine right now?
Yes, there's some media. Some media shows that they conducted the interview on the street, and then some people say the majority of the people do not want to take the COVID-19 vaccine. But I think we do not have an actual number of the vaccine hesitancy. So I think we need to carefully monitor about the general acceptance of the COVID-19 vaccine.
Good. And what are you telling your patients?
Yes. Yeah. I recommend the COVID-19 vaccine, of course, because it's already proved its efficacy and safetiness in other countries.
Excellent. And if I could go back to Saito-san, I've heard in Japan that there are going to be coupons distributed to people or slips of sheet that tell them when to go and get the vaccine and where to get that. Could you tell us a little bit about that system?
You mean the coupons or the access to the vaccine?
Yes, I do. And by comparison, in the United States, we have pretty much a jungle system where each of us is trying 5 or 6 different pharmacies or websites or hospitals to see if we can grab an appointment before somebody else does.
So details of the access process is in development, and the municipalities are preparing for that system at this moment. But the difference between the US and Japan is usually in our country, the doctors give the shot, not at the pharmacy or the super Walmart pharmacies or somewhere. Just we have to develop some clinics or some places dedicated for the dedicated for vaccination with the freezers or other facilities. So but it's a quite different mass vaccination program. So we now it's in development. But the people who are to be vaccinated were given a coupon by mail, and they will get a reservation for the time and place but the system is in development.
Wonderful. It still sounds, even at that it'll be an improvement over what we've seen on this side of the Pacific. I wanted to, before moving to audience questions, and I do encourage people to type them in on the YouTube channel, I want to talk about what lessons should we be taking from Japan's experience? Are there things that we could replicate in the United States or Europe or Africa or South America? And for that, actually, I should go to Sakamoto Sensei to start there. And I'll say, I know she already spoke about UHC, universal health coverage. So I don't know if that would be one of the ones you would talk about.
Okay, yes, thank you for the question. So I think another point, as I mentioned earlier, but the countermeasures for the long-term care facilities and nursing homes. So we in Japan, those facilities are well prepared for the infectious disease control at the facilities even before the COVID-19. So I think in order to protecting the older generation, I think how we are do the infectious disease control at those facilities are key. And then also how we encourage the behavioral change, especially for the younger generation, because the younger generation usually they are not really get severe, even they infected with the COVID-19. So it's sometimes very difficult to encourage the behavioral change of those younger generation. So the good communication between the government and then the general public, especially younger population, is the key, I think.
And could you give me an example of what good communication with the younger generation has been? There's one.
Thank you. I think they are maybe Saito Sensei will know about this question, but I think this communication has been a very challenge in Japan as well. So the government and the ministry try to send a message to the younger generation, and sometimes using the influencer, like this very famous one, but I think we are still struggling about how we effectively convey a message to the younger generation.
Thank you. And I'll switch to Saito Sensei. You could also talk about the communications, but other examples that the rest of the world should be taking.
Yeah, thank you for the very difficult question, because we recognize that problem since the early March last year, because the younger generation is the driving force of the pandemic, but the risk is pretty different. They have a lower risk, but older population have a higher risk. but we do not want to, make the generation divide between younger generation and older population. So the simple message is we have to unite together, for the government, individuals, or companies, or enterprises, all have to go to the one direction to make a more resilient country, to make a resilient society to pandemics, against pandemics. And we have to, install the infection control measures every corner of the society, and make it somewhat the culture of the society. That's a very important message to fight against this disease for a mid to long term.
And let me push. What do you mean by infection countermeasures?
So, for example, these 3 C's, avoiding 3 C's is one of the main point, and also the other basic sanitation measures like hand washing or cough etiquette that should be maintained, even though we have a good access to vaccines.
And I'll come back to Sakamoto Sensei shortly, but I just want to keep pushing you on this. How much of Japan's success is just because of Japan's unique social cultures, meaning mask wearing and speaking in low voices on the public transportation, et cetera? We heard a lot about that, but is that a really important factor?
Yes. It's difficult to show the actual number, but of course it's played a very important role, especially the very beginning of the infectious disease, because every winter, even before the COVID-19, people are usually wearing the masks and then the hand washing. It's a kind of the everyday routine for everyone in Japan. So I think it's played a very important role, I think.
Thank you. I wanted to go and start taking the questions from viewers right now, and there are quite a number of them pouring in here. And it seems every second or third question is on the Olympics, and if people, how international visitors will come, how you can make them safe. And then I'd say another question, the other top level of questions here really is about travel. How safe is it to travel to Japan during the summer? I think we have a lot of people that seem to want to be going to Japan this summer. And what are the entry policies as well? And maybe if I can ask you, Sakamoto Sensei, to take that first, and then we'll go to Saito Sensei.
Okay, so for the first question about the Tokyo Olympic Games, I think it is now very difficult to answer because if we think about the Olympic Games, we need to think about not only in Japan's situation, but also the situation in other countries. Because if we have an Olympic Games, it means we accept many people from many countries. So even in Japan, even in Tokyo is under the control of the COVID-19, but if we accept many people from the countries where the COVID-19 is still endemic, which means a very high risk for the Tokyo and Japan is the experience the surge again with the COVID-19. So I think if we only focus on the situation in Tokyo and Japan, I think we can somehow manage the COVID-19 control, but I cannot say anything about the situation in the other countries. And then also the vaccine is already started in many countries, but it's still limited to the high income countries. And then low and middle income countries, the vaccine is not fully available in those countries. But if you have an Olympic game, we also accept the people from those countries. So we are not really sure about the vaccine schedule in the other countries. So I think it's very difficult to say at this moment if we can have an Olympic game this summer or not.
And am I correct in understanding that there's no requirement that people be vaccinated if they're visiting Japan, whether for the Olympics?
At this moment, yes, for the vaccine, yes, there's no requirement. That is my understanding.
Really? And if I can turn to Saito Sensei, Dr. Saito, and particularly on the travel restrictions, what's needed to enter Japan, if you could tell us a little bit what's needed now, and then if you anticipate that changing anytime soon.
Yeah, that's also a very difficult question. In the public health term, introducing the visitors from the endemic countries become somewhat a risk for the causing another wave in our country. So so we should carefully monitor the other countries, the epidemic situation, and we carefully consider the risk assessment. And risk-based approach is we should take the risk-based approach for the border control and quarantine measures.
And who decides the border control restrictions at this point? Is that the health ministry? Is it the Ministry of Justice, or is the Prime Minister's office?
It should be whole government approach, because there are a lot of perspectives on the country risk assessment.
Thank you. We're jumping around. I'm not sure who's best to answer this. It may be Sakamoto Sensei, but I'm not sure. But a question on schools, and obviously that's been a big issue in all of our countries. But it's a question: what's the status in secondary and elementary schools? And I assume what worked and what didn't as well.
Okay, so this is my personal view, but I think the school, in general, kids, elementary school or junior high school students, those are kids are low risk of the COVID-19. So it's, of course, depends on the total situation of the COVID-19, but I think in the current status, I think we should not close the school, because the closing the school also have a very negative impact for the children. So they lose the opportunity for learning, and then also school is not only just for the learning, but also the very good place for, playing with other friends, and then the many other social activities. And then also the last year during the state of emergency, school were also closed. But during that period, some say that the child abuse has been increasing during that period. So I think from the public health perspective, I think it's sometimes better to close a school in order to prevent the further spread of the COVID-19. But I think we need to think about the balance between the positive and negative impact of the school closure. And we need to be really careful about the negative impact of the school closure, like the losing of the learning opportunity, and then also the increase of the child abuse.
And currently, are most schools open right now?
It depends on, so the nursing home, nursing school, and then elementary school, I think they are open, but in the college, university, they are only online.
Thank you. And I have another question. I think I'll go to Saito Sensei, but then Sakamoto-san, maybe you can follow up on this. And there are a number of them on health system capacity. And one is on hospital capacity, which was a concern for COVID patients. And the question is if there are any specific measures to expand bed capacity. And I said, I'm sitting in New York, and there was a directive that came down from the governor of New York State that within a week, all New York hospitals had to expand to 150% capacity. So that was sort of one question. And the other question is more broad about why was the Japanese medical services, why were they overwhelmed by such a small number of COVID cases, and what's been done to make it more resilient? But I'll start with Dr. Saito.
So thank you for this very difficult question again. And the health surge capacity of the medical services is a very important part on responding to pandemics. And the resources are very limited. And if you can expand the ward capacity to accept the patient, we have to reduce the level of the services to that patient. So just expanding the walls or physical capacity is not the answer to fight against this disease. So the resource should be primarily allocated for the control of the disease. But we have to think of our efficiency or the surge capacity for the medical service too. Especially in this January, we have to take care of these cases who have a very underlying disease, or elderly, or someone who needs oxygen support, they have to be stay at home for waiting for the hospitalization. We should think of another way of taking the medical services for during such phases. So, and we have many hospitals, and they should have a good level of the infection control measures to accept the COVID-19 patients. At this moment, we mostly use those who have a good facility and techniques for the infection control measures. But we should bottom up the level of those measures. That's another challenge for the next phase.
Thank you. And I am going to hand this off to Dr. Sakamoto, but I am taken by your point that it's expanding bed capacity alone doesn't do that. And what comes to mind, as the spouse of a healthcare worker, is that it's really the healthcare workforce. You can't expand the number of doctors, nurses, and people working in the medical system that quickly, and they're bearing the brunt of this. So could you talk to that a little bit? And particularly if these people are being mobilized to chase after clusters around the country. So I'm sure they're working overtime already.
Yes. Okay. Thank you very much. So I think Japan is known that high number of the hospital bed compared with other countries. But we need to be very careful about this point because the hospital bed, it includes not only the acute phase bed, but also include the long-term care and nursing care beds. So if we compare the number of the hospital beds only for the acute care or intensive care, the number of the bed does not really different between Japan and other countries. So some say Japan has a very large number of the hospital bed, but it includes the long-term care or nursing care bed, which does not are for the COVID-19 patient. So, and then also for the intensive care unit, I think the number of the intensive care unit is not that high, not that much in Japan compared with in other countries. And then also the important point is that we do not have the enough human resources, especially for the intensive care unit. So the average number of the physician is slightly lower than OECD average, and then among them very few are in charge of the intensive care unit or those emergency care unit. And then before the COVID-19, government are very worried about the working condition of those physicians because they usually work the overnight and even the several days without any day off. So the working condition is not really good before the COVID-19. So they are chronically very tired of seeing this kind of the intensive care patient. And then the COVID-19 started. So there's a concern about the motivation for those physicians and nursing who are working on an intensive care unit.
Thank you. And in the intensive care units, were there any cases where they were over capacity, where people couldn't get the treatment that they needed? Which is something that we, of course, saw a lot in the United States. The ICUs, where people are intubated, they were overflowed.
Yes, yeah. I think there's no actual numbers, but some paper already published about the burnout of the physicians who are working at an ICU unit.
Very good. And maybe I'll stick with you because the burnout is a key issue here. And I thought maybe you could handle this question and then Dr. Saito. But there's one about mental health issues. And it's, I think, really geared towards, people who are isolated at home, but I know it's also an issue for healthcare workers as well. And can you tell us what you've seen with that? And I'll start with you, Dr. Sakamoto.
Sorry. Yes. So of course it is very important about the mental health among the physicians, and then also I think it's not only in Japan but also in the other country. But the number of the suicide has been increasing in Japan, especially since last October. Especially the young female and then the younger generation, like the children and the school age children, the number of the suicide has been increasing. So of course there's a very different different approach for the healthcare professional and then also for the general public about how we can support the mental health of those population. But we have of course, we are very concerned about the mental health of the healthcare workers, as well as we are very concerned about increasing the number of the suicide.
And Dr. Saito, I'd love to hear how much have at the policy-making level have mental health issues been a consideration in the COVID response?
Yeah, in the advisory board of the MHLW and also the subcommittee for COVID-19 response in government of Japan have some communication experts and the social scientists to work on the some mental health issues and also for the prejudice and discrimination against the healthcare workers and those who suffered the COVID-19. So that is a very important part of the whole response strategy, and they also have an opportunity to communicate with the media on this problem. But we are still continuing this conversation.
Thank you. And you talked about prejudice and discrimination against healthcare workers. Has that been a major issue?
Yes, it is. So especially so for example, I hear that some of the healthcare workers who are working in the hospital, their families, such as the children, are not accepted by the nursing services sometimes. So such kind of public response is just stressful for the healthcare workers.
That's terribly difficult. It's something we've seen around the world, but I'm sorry to hear that's happening there as well. Another question coming in, and maybe I'll go to both Sakamoto Sensei and then Saito Sensei, but this is really about balancing the economy. The state of emergency is going to continue for quite a while. So I'd love to hear, almost from a physician's perspective with Sakamoto Sensei, what the considerations are being made in terms of where you weigh the economy and then Saito Sensei, if you could talk a little bit more about the policy level discussions on that. Please, Sakamoto Sensei.
Okay, thank you very much. I think this is a very difficult question. And then I think every country is struggling about how balance the infectious disease control and then economic and social activities. But when we see the global numbers, those who are good economic recovery, which means those countries, the number of the COVID-19 infection, the number of COVID-19 deaths is very low. And we cannot see any country like the very high number of the COVID-19 patient and the COVID-19 deaths, while the economy is not very good. I think this is there's no country with such, high number of the COVID-19 cases while the economy is very good. So if we'd like to keep the social activities, if we'd like to have a good economy situation, I think we need to have a very intensive measure for the COVID-19.
Thank you. Thank you. And Saito Sensei? And I believe you're muted here right now, Dr. Saito, but I'm curious more at the policy level, the high-level policy level, how this balance is being sought, because we're all struggling with this.
So we started work for the cluster response task force from the early February. And first 2 months, we can just think about our epidemic situation and control of the disease. But when we have to choose our social distancing measures widely, for example, declaring state of emergency, we had to carefully consider about the impact to the economic activities. And we do need some, support for those who are affected, especially in this second state of emergency. So we asked the restaurants and bars to close after 8 p.m. That is a huge impact of them. So the government supported with the certain amount of money for the compensation for those restaurants and bars. And maybe so since financial support is one of the mitigation of those who are affected, but the travel and other travel related industries are very difficult to recover for the long term. So we have to but we should recognize that this this problem is been to longer term, and we have to think about another strategy, such as the restructuring the industry, or the another way of the new industry, developing another new areas of activities. So we have to think the new way of economic activities. So
I think that's bracing for all of us, and there actually been a number of questions that came through on that topic, and they're along the lines of when will Japan finally feel that it's in the clear on COVID? When will Japan reach herd immunity? And if I can go, maybe Sakamoto Sensei, if you could talk a little bit to that, and then I'll come back to you, Saito Sensei, as well.
Okay, so as Saito Sensei explained, the vaccine just started this month for the healthcare professional, and then we are planning to roll out for the older generation, and then after that the general public, including the younger generation. But we are still not really sure about the exact schedule when the older population are vaccinated. And then of course, this is not mandatory, so some people do not want to take the vaccine. So we are not really sure about the actual number of the vaccines vaccination. So I think for the short term, I think it depends on the vaccine schedule and then the actual number of the vaccination. But of course, there's many uncertainty about when we can reach herd immunity, or when we can go back to the normal life before the COVID-19. But I think it is not very easy to go back to the normal life. So even the vaccination start, I think we need to keep our personal hygiene, like hand washing and wearing the masks, and then also avoiding the 3C. I think we can keep these countermeasures for a year or more.
Okay, that's encouraging. I keep hearing you go back to the issue of preparation and infection control and these kind of everyday practices that we can take to plan for the next disease. I'll go Dr. Saito. I don't imagine you're going to give us a precise date either that we can all be clear and happy.
So at least I can say that it's not just 6 months or several months or within a year, but we have to work on, as I said before, we have to work on installing every corner of the society on the basic sanitation measures, even though even when the vaccine is widely available, as Dr. Sakamoto-san said.
Thank you. I think we're all bracing for that. Although I do have to say, in the United States right now, particularly these couple of weeks, we're feeling a feeling we haven't in a long time, and I think that's hope. As our family members get vaccinated and spring is on the way. A few people wrote in about testing issues, about how to get COVID testing, but particularly, I think this relates to a question that I've had all along, is that the testing did seem to be quite limited in Japan. And I was comparing Tokyo, or rather New York earlier. In New York City, still we're doing 40 to 50,000 PCR tests per day. And I understand that's probably around the range or a little bit lower than the whole country of Japan is doing per day. Yet Japan has been such a success. How is that possible? And that's Dr. Saito. I'll start with you on that.
It used to be, the capacity, testing capacity was a little bit relatively limited at the early phase, but now it's more widely available in the even in the private clinics. So the ideal situation is that the people can be tested when they want to be tested. So, but the public health perspective, we have to prioritize the testing and tracing and isolation capacity first, not for the whole mass screening testing or something. So when we can contain perfectly this disease, maybe mass screening is one of the option for the maintaining such zero corona strategy. But in this phase, we have to more focus on the testing, tracing, and isolation rather than the mass screening.
Thank you. And I'll go with Sakamoto Sensei as well. And I know you've mentioned these customs, infection control, mask wearing. And I'd like to hear your thoughts on it. But also, if I could just add to that, what percentage of people that you see on the street in Japan are actually wearing a mask? Because as you know, that's become a hot issue in other countries around the world.
I think for the masking, I think almost 100% in Tokyo area. I don't know other areas in Japan, but I think in other areas too, most of everyone. When I go on the street, I never seen someone without a mask in Tokyo. Yes.
Good. Thank you. And I did want to come back. There are a couple of questions here. Again, following up on our discussion on ICUs. But was there ever a shortage of oxygen or ventilators that you saw in the hospitals in Tokyo or elsewhere, incubators as well? The physical capacity, in a sense, Dr. Sakamoto, did that ever get exceeded during any of the waves?
So I think since last December to early January, we have the biggest wave of the COVID-19. And at that time, especially in the Tokyo areas, there's some shortage of the healthcare resources, including the incubation machine. So I do not have any actual number, but some say some physicians, those who are working at the tertiary care hospital, say that they cannot see the patient as a COVID-19 patient because they need to concentrate on the COVID-19 patient. And then if it in the ordinary time, they can accept the other patient like the acute myocardial infarction or stroke or trauma patient, but sometimes they have to give up for those patients. But I don't know the actual number. I think government is currently gathering that information at those times. But yeah, I mean, actual voice from the hospital, some says, yeah, they have to give up to those patients.
That's sad to hear. But thank you. I wanted to I think we only have a few minutes left here, so I wanted to see what else we should be asking, frankly, get your opinion on it and Dr. Saito's. And so I was going to start with Dr. Saito. And if there's any other aspect of the Japan's COVID experience that you really think should be relayed overseas, that you want us to understand, I'd love to see what you think. And sorry for putting you on the spot there.
So we promoted the 3 Cs concept everywhere, but still it's not well known to the other countries, I believe. So we have to promote the what we can do for by the individuals and the personal prevention measures. We have more room to work on it.
Thank you. And then I'll turn to you, Dr. Sakamoto. What should be the takeaway for people outside? What message do you want to send to them?
Okay, thank you. I think the same as the Saito Sensei, I think 3C is a very important concept, but I think it is not really known in other countries. And then also the cluster approach or retrospective contact tracing is also key for the COVID-19. And then I think our previous discussion about the testing. So I understand Japan's testing policy and widely criticized both within and outside of the country, but I think testing is just the one part of the comprehensive countermeasures for the COVID-19. So I think we need to think about overall picture about the countermeasures for the COVID-19 control, not only just too much focus on the testing, but also the testing, isolation, and then treatment or vaccination. I think everything is a very important component of the COVID-19. So I think to not too much focus on some very tiny part of the countermeasures. I think, yeah, that's my takeaway.
Thank you. And as I hear this, I think we've come away with a couple lessons. And one is a sense of a comprehensive approach where it's not just about one tool, not just testing, not vaccines, but it's using everything together comprehensively, clear communications, particularly for youth, UHC, universal health coverage. And then I think the preparedness, in a sense, for pandemic preparedness that Japan had. And then finally, this whole discussion of sort of a feeling of community solidarity, national solidarity. It's very important. And I hope we can emulate what Japan has done. We have to close it here. It's probably too early. I want to just take the prerogative as a moderator to not just laud Japan Society for doing this at such an important time, but particularly the staff at Japan Society with Tomoko Okuno working under Josh Walker for organizing all of this. And then I particularly want to thank you, Dr. Saito, Dr. Sakamoto. This was really fantastic, a tour de force. So thank you very much.
Thank you.
Thank you.